The RFA is sort of expensive overhead-wise.
Mm-hmm.
We use up probably $2,500 worth of stuff.
Mm-hmm.
Okay? If you count all the xylocaine, all the sterile gowns that we have to throw out after the procedure, those are expensive. All the sterile towels we put around the neck, the financing cost on the machine, a lot of people do lease purchase on those. So there's a financing cost on that. You have to have an ultrasound machine. Those are $25,000 minimum, sometimes a lot more. There's a financing cost on that. You have to have a good table that moves up and down and tips. Those are $5,000. You might have a financing cost on that. And then the needle itself is almost $1,500. Just the needle.
Right.
And you have to throw that out when you're done. So we're out of pocket. We're spending $2,500, maybe even more. We also have that saline, which is the coolant. And you might go through 2 or 3 bags of saline. And of course, when you have a big nodule, that means that the personnel time is longer.
Yeah.
And then you have to pay Dr. Louisa and Dr. John to do the procedure. Well, you're behind. And we can't do it for free. We have to pay our overhead. We have to pay our rent.
Right.
So most of the people who were doing this before the CPT code were charging about twice what Medicare pays. Okay? Which I think is fair. Of course, it's hard for patients to come up with that much money.
Sure.
A lot of us had to develop payment plans. But the number one complaint about this is actually not the amount. It's the fact that the Medicare rule will pay hospitals for all this extra overhead. They actually give them a separate fee called a facilities fee, which pays for the room and the equipment and the debt service on the equipment and the table and the anesthesiologist and the circulating nurse. So they get an extra big chunk above $2,900.
Wow.
And when we do it in an office, which, one of the major benefits of this is it's low cost, right?
Right.
But we don't get that facility fee. It's zero.
Yeah.
So we have to get the patient to make up for that difference.